Convening our 9 o'clock AM agenda, April 14, 2022, Thursday, in conference room 329 for the House Committee on Health, Human Services, and Homelessness to hear the following resos. To go over some housekeeping rules, please refrain from any profanity or uncivil behavior during your testimony. Each testifier will have 2 minutes in order to get to testify to get as many people through as possible. If you have any technical difficulties that are cut off during your testimony on your end, you're allowed to rejoin. The House is not responsible for any technical difficulties on the testifier's end. If something were to happen and there's such as a network failure, proper notice will be sent out for decision making or reconvening to complete the resos. So with that, we will begin with SCR2. First up, we have DCCA.
Good morning, Chair, Vice Chair. I apologize. My camera is not turning on. My name is Alani Kioki. I'm the licensing administrator for the Department of Commerce and Consumer Affairs Licensing Division. The division will stand on its written testimony in support of this resolution. Thank you.
Oh, and I forgot to read the title of the resolution. It's requesting the auditor to conduct a sunrise review of the certification and regulation of community health workers. Next up, we have Department of Health.
Thank you, Vice Chair Tan and Chair Yamani. I'm Lola Irvin, representing the Department of Health, and the Department of Health also supports SCR2, SD1, and we have relied heavily on community health workers during COVID-19, and we support then this sunrise audit to find out what it would cost to certify community health workers and to have a program in DCCA. So we continue to appreciate and support then the building up of community health workers through training and through their engagement in the community. Thank you for the opportunity to provide testimony.
Thank you. And next up, we have Hawaii Public Health Institute.
Good morning, Chair, Vice Chair, members of the committee. My name is Rosalind Handy, representing Hawaii Public Health Institute. In support of SCR2 SD1, we stand on our written testimony, and I just wanted to take this time to acknowledge the valuable work that community health workers throughout the state continue to do. With the Sunrise Review, we just hope to learn more on how we can support the growth and framework development for the CHW profession. Mahalo for this opportunity to testify and support.
Thank you. That is all that we have signed up for to testify. Is there anyone else testifying on SCR2? Members, any questions? We also have a number of individuals who submitted written testimony in support and a number of individuals that have submitted written testimony with comments. Next up, we're going to move on to SCR10, requesting the Department of Human Services conduct and to study the feasibility of increasing the Medicaid reimbursement rates for community care foster family homes, expanded adult residential care homes, and other types of home and community-based service care providers and services. First up, we have DHS.
Aloha Chair, Vice Chair, members of the committee. I'm Judy Moore Peterson. I'm the MedQuest Administrator, which is the Medicaid Director for the state of Hawaii. And on behalf of the Department of Human Services, we very much appreciate the intent of this resolution, and we provide comments. I would like to note that we currently have a number of sort of rate studies and feasibility studies in play on this very topic, and it's leading us to very much appreciate the intent. Thank you so much.
Thank you. That is all that we have signed up to testify. We do have a number of individuals that have sent in. Oh, actually, we only have one person that sent in comments. Members, any questions? Seeing none, we're going to move on to SCR 33, requesting the Blood Bank of Hawaii to immediately adopt the Food and Drug Administration updated guidance, which shortens or eliminates the deferral period for certain blood donors. First up, we have Ms. Rebecca Soon in support. Seeing she's not present, that is all that we have. That is all the individuals that we have signed up to testify. We do note that we have one testifier in opposition. Members, any questions? Is there anyone else willing to testify? Seeing none. Moving on to SCR 42, urging the Hawaii Health Systems Corporation to extend the Ka'u rural health clinics to improve access to urgent care and outpatient behavioral health services. We do not have anyone wishing to testify, but we do have a number of individuals all in support. Is there anyone on Zoom that would like to testify on the measure SCR 42? Seeing none, members, see there's no one to answer questions. We're going to move on to the next one. We're going to move on to SCR 53 SD1, designating the month of September 2022 as Child Care Provider Appreciation Month. First up, we have Children's Action Network Speaks.
Aloha, Chair and Vice Chair. Kathleen Auger with Hawaii Children's Action Network Speaks. We stand on our strong testimony in support of this measure, and we just want to thank the committee for your support as well. We know that childcare providers have been serving and supporting families throughout the pandemic and long before, and we think this recognition is long overdue. So thank you for the support.
Thank you. That is all that we have signed up to testify. We do have a number of individuals all in support that have submitted written testimony. Is there anyone else willing to testify on the measure for us? Members, any questions? Seeing none, we're going to move on to SCR 82, requesting the auditor to conduct a performance audit of the Department of Health, Hawaii State Hospital, and the Hawaii Information Portal. We do not have anyone signed up to testify, but we do have a number of individuals testifying in support and two testifying with comments. Is there anyone on Zoom or in the audience that wishes to testify on SCR 82? Seeing none, members, unfortunately, there's no one to ask questions to. So we're going to move on to SCR 100 SD1, requesting the Department of Health to convene a therapeutic working group to examine the medicinal and therapeutic effects of psychophyllin. Psilocybin, and develop a long-term strategic plan should Food and Drug Administration approval for medical use be obtained to enable the availability of therapeutic psychophyllin and psychophyllin-based products that are safe, accessible, and affordable for adults 21 years of age or older. First up, we have Hawaii Health Harm Reduction Center. Next up, we have Drug Policy Forum of Hawaii in support. Akamai Cannabis Consulting in support.
Good morning, Chair, Vice Chair, members of the committee. Thank you for the opportunity to provide testimony in support of this measure. My name is Dr. Clifton Otto, and I just wanted to offer a couple of additional comments to my written testimony. I've been trying to stay out of this discussion of psilocybin because I didn't want to confuse it with my work on a federal exemption for our medical cannabis program. But it seems that the two have become intertwined because of the changes that were done to this measure by the Senate, which I see as creating a dangerous precedent for making strategic planning dependent upon FDA approval of a drug product intended for interstate marketing. And so we do not want the state's authority to decide how controlled substances are regulated within the state to be dependent upon FDA approval of a drug product for interstate marketing. That's why I suggested a change to revert one section of this resolution back to its original version. We also don't want the state creating another medical program that requires patients to violate federal law to participate, which is why I suggested an amendment that would have the working group look at ways to prevent any conflict between the state and federal regulation of psilocybin in Hawaii. So those are my comments. Thank you for considering my amendments, and I will be available for any questions. Aloha.
Thank you, Dr. Otto. Next up, we have Clarity Project in support. Not here. Next up, we have Anna Camacho in support. See, moving on. Next up, we have Robert Patterson in support. Not here. Next up, we have Sean Lester in support.
Aloha kaku. First of all, I really appreciate you taking this on as a possibility. I'm a 6-year active Vietnam veteran who've been very active in helping veterans over the years. I've had many of my brothers and sisters die on the streets in different places over the years because of extraordinary burden that we carry after being in combat. The VA for a long period of time was a real problem, but they've really over the last 10 years done their absolute best to help us. However, the challenge is when you take the burden of combat on and you put your life at risk when you're a child, when you're a young person. For me, it was 19 to age 26. It changes the rest of your life. And you carry this burden with you and you try to work with it. It impacts everything around you. I've talked with veterans and I've talked with folks that have worked with psilocybin, and the short-term dynamic effects of this are extraordinary. They've helped people that I've known directly, and I've seen people that I've known for decades change within 2 months. 2 months. People that were off the grid, living on the street, other things. Please give this a chance. If you save one veteran, you've done an extraordinary service for us. And what Dr. Otto was just talking about is germane. Don't turn this into another hat trick. Please give the psychologists what they really need to work here. They're asking for a 1-year study where they can come back to you and give you real dynamic information. So on behalf of my brothers and sisters, my disabled brothers and sisters, and the ones that have died because they didn't have this type of extraordinary possibility, I'm really asking you from my heart to pass this and also to listen to what Dr. Otto is saying regarding what he's asking for. If you have any questions for me, it's fine, but I think I've pretty well spoken for myself and for those that can't speak for themselves.
Can you please summarize your testimony?
Oh, sure, I'm sorry. Please vote in favor of this. Thank you very much. I appreciate your time.
Thank you. We're gonna go back to Clarity Project. Are they available to testify on SCR 100?
Awesome. Hi, Chair Yamane, Vice Chair Tam, members of the committee. Sorry for our delay. We had issues finding parking at the cab. We're not used to all the different rules. Yeah, we made it. My name is Duration. I'm the project manager for the Clarity Project. And We're a citizens advocacy group made up of medical professionals, community advocates, veterans, cancer patients that are really calling for an open-mindedness around the medical and therapeutic benefits of psilocybin. The FDA signaling really positively towards it. We're seeing really reputable academic institutions like Harvard University and Imperial College in London, and really many, many others developing psychedelic research centers across the world. And, it's really just showing a positive trajectory. And so what this resolution is calling for is just to establish a working group under the DOH to explore these benefits and to eventually establish access through a long-term strategic plan. We would like to respectfully request that the previous amendment that was added about waiting on FDA approval gets changed back, just because it is within the state's jurisdiction to decide when access should be granted for substances like we saw with cannabis. So we just want to make sure the state remains in having that power and not relinquish that to the FDA. But the FDA is signaling approval in the next 3 years or so anyway. So it should be on that way anyway. So I'll be available for questions. We also speak with, people who are suffering every day from mental health illnesses, who are happy to speak to any of your offices about this important issue. And, I'll be available for questions. Thank you.
Thank you. Is there anyone else wishing to testify on the measure for us? Go ahead. State your name and your position on the measure.
Okay. Hi, Chair, Vice Chair, and Committee. My name is Ana Camacho. I live in District 19 in Kaimuki. I'm testifying as an individual, but I also work on the Clarity Project. And so I wanted to piggyback on Duray's testimony and ask you to respectfully request to reconsider changing the resolution back to its previous form without the FDA approval amendment. And this actually marks the first time I'm submitting testimony in person at the Capitol. And that's because I think it's so important that people have safe access to one of the most natural, effective, and non-addictive treatment options for anxiety and depression. And this is because psilocybin has personally helped me in managing my anxiety. It's helped me overcome alcohol addiction, and it's helped me also with bouts of high functioning depression. So my written testimony is there as well, and I'm available for questions if you have it. Thank you.
Thank you. Is there anyone else wishing to testify on SCR 100? Seeing none, members, any questions? Seeing none, we do want to note that we do have a number of individuals that have submitted testimony in support, and the Hawaii State Department of Health and the Hawaii Psychiatric Medical Association submitting testimony opposition. Moving on, we're going to go to SCR 102 SD1, requesting the Office of the Auditor to update its Child Welfare Services Branch Assessment Standards pursuant to House Concurrent Resolution 165, Regular Session of Hawaii 2010. First up, we have Department of Human Services.
Good morning, Chair, Vice Chair, members of the committee. My name is Tim Hitchens, Social Services Division Assistant Administrator, and we stand on our written testimony offering comments.
Thank you. Next up, we have Kapua Medeiros in support.
Aloha. Aloha, Chair and committee members. I am in support of SCR 102, the SD1. I'm raised in Waimanalo, and I did submit written testimony, but I would just like to add to that as a Waimanalo community member, our community was faced with a lot of grief and are currently working on other solutions, but we strongly support SCR 102 so that it will create a better system of assessment of our child welfare services department. And also as a Waimanalo community member, I feel that this action is necessary to prevent any other children from falling victim to the system's failures, as did Ariel Sellers. And again, I am asking that you support and approve SCR 102 and make the much needed improvements to our child welfare system here in Hawaii, so that no other child, no other family needs to go through what the Sellers Ohana did. And that is Ariel Sellers, also known as Isabella Kalua, and named that by her murderers. So thank you very much for allowing me the opportunity to testify in support of SCR 102, SD1. Aloha.
Thank you. That is all that we have signed up to testify. We do want to note that the Office of the Auditor has submitted comments, and we have a number of individuals that have submitted testimony in support, including the Waimanalo Neighborhood Board. Is there anyone else wishing to testify on SCR 102? Seeing none. Members, any questions? Seeing none, we're going to move on to our next item on the agenda, SCR 124, urging the Department of Health and the Department of Human Services to work with community partners, including the YMCA of Honolulu, to support the mental wellness of the state's youth. First up, we have Department of Human Services offering comments.
Aloha chairs, or chair, vice chair, committee members. Joseph Campos, Deputy Director, Department of Human Services, here on behalf of Director Betts. The Department of Human Services appreciates the intent of this measure and offers comments. So thank you for allowing me to testify.
Thank you. Next up, we have Stonewall Caucus of the Democratic Party of Hawaii in support. Not present. Oh, next up we have YMCA of Honolulu.
Aloha, Chair, Vice Chair, and committee members. My name is Greg Weibel. I'm the CEO of the YMCA of Honolulu, testifying in support of SCR 124 and stand by my most recent testimony submission. With the YMCA, we're passionate about helping our youth improve their mental wellness and welcome additional community-based organizations with the support of the Departments of Health and Human Services to develop program opportunities across the state. Mahalo.
Thank you. And that is all that we have signed up to testify. Is there anyone else on Zoom or in the audience that wishes to testify on SCR 124? Seeing none, members, any questions? Okay, seeing none, we're going to move on to our next item on the agenda, SCR 130. Requesting the Department of Health and Department of Human Services jointly review any research regarding applied behavioral analysis for adults and to develop and adopt all rules, policies, and plans amendments necessary for the state's Medicare program to cover medically needed services, including applied behavioral analysis services for individuals aged 21 and older with neurodevelopment disorders, including autism spectrum disorder. First up, we have Department of Human Services with comments.
Aloha Chair, and members of the committee. I'm Judy Moore Peterson, MedQuest Administrator, and on behalf of the Department of Human Services, we do offer comments with concerns. We greatly appreciate the struggles that the families are facing. At the same time, we have concerns in the way in which this resolution is drafted. Thank you so much for the opportunity to testify. I'm available for any questions. Thank you.
Next up, we have the Hawaii State Department of Health in opposition.
Good morning, Chair, Vice Chair, members of the committee. I'm Mary Brogan. I'm the administrator of the Developmental Disabilities Division, Department of Health. And the Department of Health does oppose SCR 130 as written. We were glad to see the suggested amendments in the SD1 that asks for review of the research because evidence and well-established clinical guidelines are requisite for covering any new service or therapy. And currently, no such clinical guidelines are in place for applied behavioral analysis for adults in the United States. We think that the resolution that asks the departments to draft rules, policies, and state plan amendments would be premature without a full cost and policy analysis, federal approval for coverage, and funding from the legislature for the state match. Thank you very much for the opportunity to testify.
Thank you. Next up, we have Hawaii Association of Behavioral Analysis and Support.
Good morning, Chair Imani, Vice Chair Tam, and members of the committee. I'm Deborah Krekel. I'm representing the Hawaii Association for Behavior Analysis. We stand on our testimony in support with comments. Given the robust amount of research supporting applied behavior analysis as an evidence-based practice for individuals with neurodevelopmental disabilities and autism, this includes adults age 21 and over, we respectfully request that this resolution be amended to the original SCR 130. This vulnerable population needs continuity of care and equitable access to medically necessary treatment, including applied behavior analysis. I'm available for questions as needed, and thank you very much for the opportunity to testify on this resolution. Aloha.
Thank you. Next up, we have State Council of Developmental Disabilities. Next up, we have Council of Autism Service Providers in Support. Next up, we have Linda Alento in support.
Good morning, Chair and Vice Chair. It's nice to meet you. I am Linda Alento, and I wanted to share that I'm a parent, and I've been involved here with the legislature almost every year, not quite every year because it was too exhausting, since my son, back in 2006. Okay, my son has Down syndrome and autism, and I support this bill because as far as Medicaid goes, a couple of main reasons when it comes to Medicaid, the federal government gives the state an option to cover certain services, one of them being ABA. ABA is, there's no substitute for it. I don't know if you remember back around 2015, there was a lot of talk about ABA. And of course we had chapter 4, I think it's 86D passed. I believe the research is already available. I was actually kind of surprised the Department of Health's testimony right now. The Senate had actually amended this particular resolution based on their comments regarding research. We need to get the ball rolling. It's just like, well, the IDA, for instance, it's a federal grant for special education. My son in particular, he gets to be in special education because he needs it until he's 22. What happened was he was able to get ABA for learning for the purposes of independent living and communication in particular based on his disabilities. It ended when he turned 21, but he's still in school. What that required us to do is to have to start over with the evaluations, going back to the Department of Health, or DDD actually, and we're still in process. I told them he's lost his services, which he'd only had for like 3 months most recently. And I saw the improvement and so forth. Yes, I'll hurry. I want you to know that there's evidence out there and how we strongly support it. And I wish I had time to offer more, but I can offer more as far as why we need this bill now. And the budget can be considered next year, but we need to get the ball rolling as far as making it happen. Thank you.
Thank you so much. That is all that we have signed up to.
Excuse me, Chair, Vice Chair, are you considering online testimony?
Yes. Is there anyone else willing to testify on SCR 130?
Hello, can you hear me?
Yes.
Okay, thank you so much. My name is Zhi Xiong, and I'm testifying in strong support of the measure as a concerned citizen. My friend's daughter is in high school and she was diagnosed with autism. She is very bright but has problems interacting socially. That is a condition of the developmental disability. It hinders significant social interactions and communication for the person who is suffering from the condition. She has a hard time getting mental health services because her parents and teachers are not trained to recognize the condition. As a disabled person and as someone who has navigated the health system, I recognize her condition and know what she needs. She needs to go to Assets and she needs mental health services. Assets is a special ed school that helps students with dyslexia, dysgraphia, and other disabilities. Public schools without an existing special ed program is not appropriate for students with disabilities. I support the resolution and its intent to request DHS and DOH to review, research, develop, and adopt policies pertaining to treatment for autism and neurodevelopmental diseases. However, I'd like to ask the legislature to consider providing services to children and youth also. There are a lot of different initiatives the legislature could try in regards to assisting those with these sorts of conditions. The legislature could consider providing basic medical training for staff at schools or at work to be able to recognize such conditions and disabilities so that the most vulnerable of our society can access equitable health benefits. Another aspect the legislature could consider is to help to fight the stigma that disabled people or people with neurological development disabilities is inferior or not capable or even stupid. Stephen Hawking was very disabled, yet he was brilliant and he could only speak through his computer. So, I could advise the legislature to consider that you should work on all those aspects for a holistic approach in regards to approaching development conditions and autism and disabilities. Thank you for the chance to testify.
Thank you. So, is there anyone else wishing to testify? Vice Chair knows that we do have written testimony here, and all the written testimony has been in support. Members, any questions? Seeing none, we're going to move on to our next item on the agenda, SCR 133 SD1. Urging the State Commission on the Status of Women to establish a task force to develop and implement an outreach program aimed at informing domestic violence victims of available sources of assistance. First up, we have Hawaii Coalition of Immigrant Rights in support.
Aloha Chair and Vice Chair, members of the committee, Liza Ryan Gill with the Hawaii Coalition for Immigrant Rights. We just stand on our written testimony in strong support of this resolution. Mahalo.
Thank you so much. Next up, we have Hawaii State Commission on the Status of Women in support.
Aloha Chair, Vice Chair, stand on our testimony in support and available for questions. Thank you very much.
Thank you so much. That is all that we have signed up to testify. We do have a number of individuals that have submitted written testimony all in support. Members, is there anyone else wishing to testify on the measure before us? Members, any questions?
Am I able to testify as well?
Sure, go ahead. State your name and your position.
Yes, my name is Kapua Maderas, and I also support that measure, SCR 130. Is it the 133?
133.
Yes, and I am, as a victim myself of domestic violence, I would like to see more help and more support for women out there who need those kind of services. And so I'm asking that you please support all bills that offer more support to women. As for myself, I did not receive very much support, but I was able to overcome all of the difficulties that I faced over the last 11 years, and I'm doing fine. But more women can benefit from services. As myself, I was just lucky that I had a group of friends who were able to surround me and take care of me. So thank you for hearing my testimony. And mahalo for supporting SCR 133 SD1. Aloha.
Thank you so much. Members, any questions? Seeing none, we're going to move on to our next item on the agenda, SCR 153 SD1, requesting the Department of Business, Economic Development, and Tourism in coordination and cooperation with the Executive Office of Aging and the County of Hawaii Office of Aging to conduct a study on the necessity and feasibility of establishing a senior living center in the Ka'u district. First up, we have DOH, Executive Office of Aging.
Good morning, Vice Chair Tam, Chair Yamani, and members of the committee. Carolyn Kadira with the Executive Office on Aging, offering comments on SCR 153. The Executive Office on Aging provides long-term services and support statewide to our older adults and caregivers. And we defer to the study done by DBED on the senior living, both at the state and county levels that they did in 2021. And we also defer to DBED for the necessity of a feasibility study. And I'm available for questions. Thank you.
Thank you. Next up, we have DBED offering comments.
Hello, good morning, Chair, Vice Chair Eugene Tian, Economic Research Administrator. With DBED, we stand on our written testimony provided comments. I'm here for questions. Thank you.
Thank you. That is all that we have signed up to testify. We do have a number of individuals that have submitted written testimony, including the Hawaii County Council and the Hawaii County Office of Aging. Is there anyone else wishing to testify on SCR 153? Members, any questions? Seeing none, we're going to move on to our next item on the agenda, SCR 181 SD1, requesting the County of Hawaii to conduct a feasibility study on the creation of a Marshallese Community Center in Hawaii Ocean View Estates. First up, we have the Kofa Alliance National Network. Okay, not present.
Hello, yeah, this is David. Can you hear me?
Yes.
Thank you very much. Vice Chair Tam, Chair Yamane, members of the Committee on Health and Human Services and Homelessness. Thank you for the opportunity to testify in support. Just to clarify, this is SCR 181, correct?
Yes. Yes.
Okay. So for the record, I'm David Anatok, Policy Director and Community Organizer for the Kofa Alliance National Network, or CAN. It's a nonprofit organization aiming to advance social and economic justice for the combat of free association and the people who are now residing in the United States under this unique treaty from Federated State of Micronesia, Republic of Palau, and Republic of the Marshall Islands. We understand the entire state has been a home or the first stop for the fast-growing population migrating from the freely associated states. We acknowledge that many good community-based organizations like We Are Oceania, Micronesia, United Big Island, Marshallese Community Association of Hawaii, and others have done tremendous and important jobs for the community, especially during the pandemic. However, this concept to focus in on Ocean View is vitally important, given the unique geographical location and the many opportunities that community in Ocean View needs to thrive. So thank you very much for the opportunity to speak in support of this good resolution. Also want to thank all the supporters, including the Hawaii County Mayor's Office and the council members, and happy to answer any questions anyone has. Thank you.
Thank you. Is there anyone else wishing to testify on the measure before us? Go ahead. Please state your name and your position on the resolution.
Aloha. I'm Dr. Rick Custodio, and I'm testifying in support of the bill. I'm a pediatrician and a professor of health science at UH West Oahu. And these are actually my students in my health policy class. I'm trying to teach them how to testify. 20 years ago, I was at Bay Clinic and I was the medical director. At that time, I was doing pediatrics also at the Ka'u Clinic. During that time, that's when the Marshallese began to move into Ocean View. And the problem was they were definitely underserved and vulnerable. There was no infrastructure there. There's no water. There was no health insurance. You may be wondering why I'm advocating for the Marshallese. It's because I was born there. I was born on the island of Kwajalein, and this lei is actually from my babysitter. She was Marshallese. She used to come over on a canoe. I've waited a long time to kind of advocate for the place that I was born. And I think this is just a small step to help people out in Ocean View and the Marshallese community in general. Thank you very much.
Thank you. Is there anyone else wishing to testify? Members, any questions? Seeing none, we're going to move on to our next item on the agenda, SCR 183, requesting the Department of Health to conduct a study to assess the healthcare needs of the residents of Ocean View on the island of Hawaii. First up, we have Department of Health in opposition.
Good morning. My name is Matthew Shim. I'm Chief of the Family Health Services Division. The department appreciates the intent of SCR 183, but we respectfully oppose the duplication of efforts. Thank you for the opportunity to testify, and I'm here to answer any questions. Thank you.
Thank you. That is all that we have signed up to testify. Is there anyone else wishing to testify on SCR 183? Seeing none, members, any questions? Seeing none, we're going to move on to our next item on the agenda. SCR 194 SD1, requesting the Department of Health to examine issues and barriers to enforcement to reduce noise from two-stroke engine mopeds and small off-road engines and make recommendations to the legislature to help reduce noise pollution from these sources. We do not have anyone signed up to testify, but we do have a number of individuals that have submitted testimony in one individual submitting testimony in support and one individual submitting testimony in opposition. Anyone wishing to testify on the measure for us?
I would like to testify again for that one. Thank you.
Could you please state your name and your position on the resolution?
Yes, my name is Kapua Maduris, resident of Waimanalo. And I also sit on the neighborhood board of Waimanalo. And I would like to say that in the community that I live in, the moped noises are often very disturbing. And not only in our neighborhood, but even when they're passing by on the highway, you can hear them, and that's very loud. I know this doesn't have anything to do with the speed that they travel, but it would be very helpful, you know, as I take care of my mom with dementia, and it's very disturbing to her to have those mopeds zip by with that loud noise. And I don't understand why they have to be so loud compared to a car or even a large truck. So I totally support getting those kinds of machines or motors to be to be quieter, for lack of a better word. Mahalo.
Thank you. Members, any questions?
Chair.
Brett Ward.
Ms. Medeiros, did I hear you say you were opposed to the bill, but you testified in support of it, from what I heard?
Oh, I'm in support of it. I'm sorry.
Okay, very good. Is Department of Health here, Chair, Vice Chair?
Is there anyone?
Is there anyone from the Department of Health who could answer a decibel question? You're the only one, Ms. Medeiros. I guess I will get an answer.
You can reach out to them. Thank you, Brett Ward. Seeing none, we're going to move on to our next item on the agenda, SCR 197, requesting the Department of Health to develop protocols for hospitals in the state to improve the treatment of patients contemplating suicide. We do not have anyone submit any testimony on this resolution. Is there anyone in the audience or on Zoom wishing to testify on SCR 197?
Chair, Vice Chair, may I ask for consideration to testify?
Sure, go ahead. Please state your name and your position on the resolution.
Thank you. My name is Zhizi Xiong, and I'm testifying in strong support of the measure as a concerned citizen. I'm well acquainted with the state's Department of Human Services, their General Assistance Program, and the various social services available to the vulnerable, the disadvantaged, and the most marginalized, as I am one of them. To be able to stand here today to ask the legislature for consideration to pass this resolution is a true honor. I'm grateful for those who have paved the road to hope, opportunity, democracy, and equitable services, and I'm inspired to also walk the walk set out before us. As a recipient of benefits from the state's welfare system, and as someone who has navigated the social, the various service providers, I'm truly grateful for the state's provisions and the various service providers' provisions, and only hope to reciprocate with comments, observations, and positive contributions to the conversation from my personal experience, which I think is valuable. So I'm deemed legally disabled by the DHS. But the DHS tried to deny me of my benefits because of all the formal procedures after assessing my functional capacity. They said I'm young and able. I had to request legal aid's senior staff attorney to work on my claim. And I had a myriad of health conditions. It can't be expected of lawyers to be doctors as well. And so I researched a lot of my claim by myself, and I learned quickly what it takes to navigate the parameters of the Hawaii revised statutes and how to get through the Social Security process, and can easily walk with someone new who hasn't done so before. My cousin was a victim of suicide in 2018 because China does not have appropriate mental health services and disability welfare for those who are at high risk of suicide. I would have gladly walked with him through the process of getting services, but no such option was available. Here in America, it is dramatically different, and it is imperative for the legislature to pass this resolution. Hospital protocols to provide one-on-one counseling is necessary.
So could you please summarize your testimony?
Okay, I will conclude. And all the other protocols listed in the resolution is imperative for the legislature to consider. Thank you for the chance to testify.
Thank you. Members, any questions?
I would also like to testify on that SCR 197.
Go ahead. Please state your name and your position on the resolution.
Yes, my name is Kapua Maderas, and I am also in support of SCR 197. And I also would like agree with Ms. Zhong, sorry for saying it wrong, but I totally appreciate her testimony as someone who had to navigate the system. Recently in Kailua, we had a young person full of potential who did commit suicide. And I just want to see those kind of instances diminished and ensure that our state is taking care of people that do need services in these instances, and that they are treated with respect and dignity. I also have one of my very best friends who is an amazing person and is so very capable of doing so many things, but because she's labeled and suffered brain injury, also attempted suicide. And I would like to say that for someone like her, it would be detrimental not to have services available for her. And she, Ms. Zhong, just reminded me so much of her because of how awesome these people are with their amazing abilities to navigate and to overcome. So I would like to ask that you please support this SCR 197 SD1, and mahalo. Aloha.
Thank you. Chair does want to recognize that we do have to take the vote very soon in order to make session and to get all these bills passed. So, members, any questions? Seeing none, we're going to move on to our next item on the agenda, SCR 206, urging the Hawaii Congressional Delegation to strongly support passage of the Women's Health Protection Act of 2021 to protect the rights of rights to access and provide abortion services. We do not have anyone signed up to testify, but we do have written testimony in support from Planned Parenthood. We have opposition from White Family Forum and several others in opposition as well. Is there anyone wishing to testify on the measure before us? Seeing none, members, any questions?
Yes, I will testify on that one as well. And it's, thank you again for allowing me the opportunity. But I am definitely in support. This is Kapua Maderas, and I'm definitely in support of SCR 206. I believe that women should have the choice, and especially when there's times that it would be detrimental to their mental health to not allow them the choice. Thank you.
Thank you. Members, any questions? Seeing none, we're going to move on to our next item on the agenda. SCR 208, urging the United States Congress and Hawaii's congressional delegation to support legislation establishing Medicare for all. We do not have anyone signed up to testify. Is there anyone wishing to testify on the measure before us? Seeing none, and seeing that there's no one to ask questions to, we're going to move on to our next item on the agenda, SCR 221, requesting the auditor to conduct a study on the relationship between the current prices of and access to medical cannabis and the volume of illicit cannabis sales in Hawaii. We have Marijuana Policy Project in opposition, ready to testify. Seeing he's not present, we do have the Office of the Auditor submitting comments. Members, seeing there's no one to ask any questions to, we're going to move on to our next item on the agenda, SCR 225, requesting the Department of Human Services to develop lesbian, gay, bisexual, transgender, queer plus specific training guidelines for state agencies that serve and assist survivors of immediate partner of violence. First up, we have Department of Human Services with comments.
Good morning, Chair, Vice Chair, committee members. Joseph Campos, Deputy Director, Department of Human Services, here on behalf of Director Betts. The Department of Human Services stands on its written testimony, appreciating the intent of the resolution and providing comments. Thank you for the opportunity to testify.
Thank you. We do have one individual submitting testimony in opposition. Is there anyone else wishing to testify on the measure before us? Seeing none, members, any questions?
Chair, could I request just like a 30-second testimony for consideration? Okay, yeah. Hello, Chair, Vice Chair, and members of the committee. My name is Shizu Xiong, and I'm testifying as a concerned citizen in strong support. LGBTQIAs are especially prone to bullying, ostracizing, and being abused socially, emotionally, and mentally. The resolution specifically refers to data evidence about LGBTQIAs experiencing abuse at a higher rate than straight individuals, but are less likely to report it. This data translates into a large number of LGBTQIA victims who are left without sources of support. So it is imperative the legislature considers urging the DHS to develop LGBTQIA specific training guidelines, and for DHS to consider obtaining input, as it says in the resolution, from relevant advocates and professionals. Thank you for the chance to testify.
Thank you. That is all that we have on Zoom. Is members, again, any questions? Seeing none, we're going to move on to SCR 229 SD1, requesting the auditor to assess the social and financial effects of mandating health insurance coverage for annual mental health wellness examination. We do not have any testimony offered on this measure. Is there anyone in the audience or on Zoom wishing to testify on the measure before us? Seeing none, members, we can move on to SCR 62 SD1. Requesting the auditor to conduct a social and financial assessment of proposed mandatory health insurance coverage. First up, we have Planned Parenthood Alliance Advocates.
Good morning, Chair Yamane and members of the committee. My name is Rachel Kinsey, and I'm testifying today on behalf of Planned Parenthood Alliance Advocates. We strongly support SCR 62. We appreciate you holding this hearing, and we stand on our written testimony and are available for questions. Thank you so much.
Thank you. That is all that we have signed up to testify. We do have the Office of the Auditor submitting comments, a number of individuals submitting testimony in support, and one individual submitting testimony in opposition. Is there anyone else wishing to offer any comments or testimony on SCR 62 SC1? Seeing none, members, any question, Rep. Ward?
I didn't see the auditor's report, but did it say, I didn't know that they could do social audits. That seems like a little bit outside of their boundary. Did their testimony say anything in that regard?
When it comes to mandatory insurance coverages, the auditor is required to do social and financial effects audits.
Yeah, according to
before
the result, but I mean, they do financial stuff, but are they qualified to do social stuff?
Yes,
They are qualified by statute, not by this resolution.
yes,
Okay, I'd like to hear Mr. Kondo say that. Thank you.
thank you. Unfortunately, he's not here. Is there anyone else wishing to testify? Members, any questions? Next up, we're gonna move on to SCR 241 SD1, requesting the auditor to assess the social and financial effects of mandatory health insurance coverage for fertility preservation procedures for certain persons who have been diagnosed with cancer and whose cancer or cancer treatment may be adversely affected their fertility. First up, we have Hawaii Society of Clinical Oncology.
Morning, Vice Chair, Chair, members of the committee. Blake Lasher on behalf of the Hawaii Society of Clinical Oncology. We're the trade association for the oncological professionals. We submitted our written testimony and support, and we will stand on that, and I'll be available for any questions. Thank you.
Thank you. That is all that we have signed up to testify. We do have testimony in support from the Alliance for Fertility Preservation. Is there anyone else wishing to testify on the measure before us? Seeing none. Members, any questions? Seeing none. We're going to do a brief recess for decision making. convening our 9 AM agenda for the Committee of Health, Human Services for the purposes of hearing the following resos or decision making. First up, we have SCR2 SD1 requesting the auditor to conduct a sunrise review of the certification and regulation of community health workers. Recommendation is to pass as is. Members, any discussion? Seeing none, chair for the vote.
Okay, the recommendation is to move SCR2 SD1 as is. Chair and Vice Chair votes aye. Chair Gates excused. Representative Hart excused. Representative Capella?
Aye.
Nishimuro? Aye. Ward?
Aye.
Thank you. Next up, we have SCR10 requesting the Department of Human Services to study the feasibility of increasing the Medicaid reimbursement rates for community health care, foster family homes, expanded adult residential care homes, and other types of home and community-based service care providers and services. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
The recommendation is to move SCR10 SD1 as is. Anyone here wishing to vote with reservations? Any no's? Fixing none.
Thank you. Next up, we have SCR33 SD1 requesting the Blood Bank of Hawaii to immediately adopt the Food and Drug Administration's updated guidelines, which shortens or eliminates the deferral period for certain blood donors. Recommendation is to pass as is. Members, discussion?
Chair, this is the one I had questions that I didn't have a chance. I'm going to be with reservation until I see what the science is and what the empirical ratings on upper or lower in terms of the period. Thank you.
Yeah, I think that the science has been very clear from the FDA's up to the Blood Bank of Hawaii's to immediately adopt those recommendations.
But Vice Chair, when it says you're going to abstain from sex for 3 months or 12 months as a way of meeting this criteria, I want to know what's the data say. Is that actually being met? That doesn't seem very practical.
I think the data is out there from the Food and Drug Administration. I encourage you to look at that.
Again, my regrets for not asking. Thank you.
Thank you. Members, any other discussion? Seeing none, chair for the vote.
The recommendation of Vice Chair is to move SCR33 SD1 as is. Anybody wishing to go with reservations?
This
Or anybody wishing to go no? Fixing none.
Next up, we have SCR42 urging the Hawaii Health Systems Corporation to expand the Ka'u Rural Health Clinic to improve access to urgent care and outpatient behavioral health services. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
The recommendation to SCR42 as is. Anybody wishing to withhold with reservation? Any no votes? Seeing none.
Moving on to SCR53 SD1, designating the month of September 2022 as Child Care Provider Appreciation Month. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Anybody wishing to go, SCR53 SD1, anybody wishing to go with reservations? Anybody wishing to go no? Seeing none.
Next up, we have SCR82, requesting the auditor to conduct a performance audit of the Department of Health, Hawaii State Hospital, and Hawaii Information Portal. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
The recommendation is to move SCR82 as is. Anybody wishing to go with reservations? Any no's? Seeing none.
Moving on to SCR100 SD1, requesting the Department of Health to convene a therapeutics psilocybin working group to examine the medicinal and therapeutic effects of psilocybin and develop a long-term strategic plan should Food and Drug Administration approval for medical use be obtained to enable the availability of therapeutic psilocybin or psilocybin-based products that are safe, accessible, and affordable for adults 21 years of age or older. The recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
The recommendation to move SCR100 SD1 as is. Anybody wishing to vote with reservations? Any no's? Seeing none.
Next up, we have SCR102 SD1 requesting the Office of the Auditor to update its Child Welfare Services branch assessment standards pursuant to House Concurrent Resolution number 165 regular session of Hawaii 2010. Members, the recommendation is going to be to pass this measure out as an HD1. I spoke with the authors of the resolution, and they also wish to have this referred back to its original form, which is without the SD1, so SCR 102. Members, discussion?
Sure, so we're gonna go back to the original, is that? the
Yes.
point?
Yeah. So instead of they're going back to HCR 165, they're going to complete another audit zone of this the Child Welfare Services branch.
Okay, thank you.
Members, any other discussion? If not, chair for the vote.
Okay, recommendation move SCR 102 SD1 with amendments. Anybody wishing to vote with reservations? Anyone wishing to vote no? Seeing none.
Thank you. Moving on to SCR 124 SD1, urging the Department of Health and Department of Human Services to work with community partners, including the YMCA of Honolulu, to support the mental wellness of the state's youth. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Recommendation is to move SCR 124 SD1 as is. Anybody wishing to go with reservations? Anybody wishing to vote no? Seeing none.
Moving on to SCR 130, requesting the Department of Health and Department of Human Services jointly review any research regarding applied behavioral analysis for adults and to develop and adopt all rules, policies, and plan amendments necessary for the state's Medicaid program to cover medically needed services, including applied behavioral analysis services for individuals aged 21 and older with neurodevelopmental disorders, including autism spectrum disorder. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Okay, recommendation to move SCR 130 SD1 as is. Anybody wishing to vote with reservations? Any no votes? Okay, seeing none.
Moving on to SCR 133 SD1, urging the State Commission on the Status of Women to establish a task force to develop and implement an outreach program aimed at informing domestic violence victims of available sources of assistance. Recommendation is to pass as is. Any discussion? Chair for the vote.
The recommendation to move SCR 133 as is. Anybody wishing to go with reservations? Any no votes? Seeing none.
Moving on to SCR 153 SD1, requesting the Department of Business and Economic Development and Tourism in coordination and cooperation with the Executive Office of Aging and the County of Hawaii Office of Aging to conduct a study on the necessity and feasibility of establishing a senior living center in the Ka'u district. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
The recommendation to move SCR 153 SD1 as is. Any reservations? Any no's? Okay, seeing none.
Moving on to SCR 181 SD1, requesting the County of Hawaii to conduct a feasibility study on the creation of a Marshallese Community Center in Hawaii Ocean View Estates. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Okay, recommendation vice chair to move SCR 181 SD1 as is. Any reservations? Any no's? Okay, seeing none.
Moving on to SCR 183, requesting the Department of Health to conduct a study to access the healthcare needs of the residents of Ocean View on the island of Hawaii. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Okay, recommendation to move SCR 183 as is. Anybody wishing to vote reservations? Any no's? Seeing none.
Next up, we have SCR 194 SD1, requesting the Department of Health to examine issues and barriers to enforcement to reduce noise from two-stroke engines, mopeds, and small off-road engines, and to make recommendations to the legislature to help reduce noise pollution from these sources. Members, recommendation is to pass as is, but we want to note in the committee report that this committee hopes that the DOH will also use this resolution to train local law enforcement in the area of enforcement on the issue of noise. Members, discussion? Seeing none, chair for the.
The recommendation is SCR 194 SD1 as is. Any reservations? Any no's? Seeing none.
Moving on to SCR 197 SD1, requesting the Department of Health to develop protocols for hospitals in the state to improve the treatment of patients contemplating suicide. Recommendation is to pass as is. We do have, although we did not have written testimony, we do have two individuals that have testified on the measure before us during the hearing. Members, discussion? Seeing none, chair for the vote.
The recommendation is to move SCR 197 SD1 as is. Any reservations? Any no's?
Moving on to SCR 206, urging Hawaii's congressional delegation to strongly support the passage of the Women's Health Protection Act of 2021 to protect the right to access and provide abortion services. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Okay, recommendation is to move SCR 206 as is. Anybody wishing to go with reservations?
No vote.
No vote for award. Anybody else reservations? No votes? Okay, seeing none.
Okay, next up, we have SCR 208 SD1, urging the United States Congress and the Hawaii's congressional delegation to support legislation establishing Medicare for all. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Okay, recommendation is to move SCR 208 SD1 as is. Anybody wishing to go with reservations? Any no's? What are you, what vote?
No.
No, okay. No vote forward.
Moving on to, moving on to SCR 221, requesting the auditor conduct a study on the relationship between the current prices of and access to medical cannabis and the volume of illicit cannabis sales in the state. We're going to, based on the testimony from the auditor, we're going to pass this out as an HD1. We're going to replace the auditor with LRB and request LRB to conduct the studies of the auditor. Members, discussion? Seeing none, chair for the vote.
The recommendation is to move SCR 221 with amendments. Anybody wishing to go WR? Any no votes? Okay, seeing none.
Moving on to SCR 225 SD1, requesting the Department of Human Services to develop lesbian, gay, bisexual, transgender, queer plus specific training guidelines for state agencies that serve and assist survivors of immediate partner violence. Recommendation is to pass as is.
Is that immediate or intimate?
Intimate, sorry.
Okay.
There's no D in this word.
That's true.
Any discussion? Seeing none, chair for the vote.
Okay, recommendation is to move SCR 225 SD1 as is. Anybody wishing to go with reservations? Any no votes? Okay, seeing none.
Next up, we have SCR 229 SD1, requesting the auditor to assess the social and financial effects of mandating health insurance coverage for annual mental health wellness examinations. Because there was no one that submitted testimony in support, I'm going to work with the author of this resolution, come back next year. So the recommendation is to defer. Next up, we have SCR 62 SD1, requesting the auditor conduct a social and financial assessment of proposed mandatory health insurance coverage. Recommendation is to pass as is. Members, discussion? Seeing none, chair for the vote.
Okay, recommendation to move SCR 62 SD1 as is. Anybody wishing to go with reservations? Ward reservations? Anybody else? Any no votes? Okay, seeing none.
Moving on to SCR 241 SD1, requesting the auditor to assess the social and financial effects of mandatory health insurance coverage for fertility preservation procedures for certain persons who have been diagnosed with cancer and whose cancer or cancer treatment may adversely affect their fertility. Recommendation is to pass as is. Any discussion, members? Seeing none, chair for the vote.
The recommendation to move SCR 241 SD1 as is. Any reservation? Any no votes? Okay, seeing none.
Thank you. Hearing is adjourned.